Hello, everyone. It is a Happy Healthcare Professionals live show. I am so excited about today's show. I know a lot of you have shown so much interest in today's show, and I really appreciate it. If you're new to the show and you've not watched this show before, then welcome. And I am your host. My name is Komal. I am a former national level pharmacist turned career coach and business strategist for pharmacy professionals. And I absolutely love helping to support pharmacy professionals with their careers so that they can create and do and be more in their careers. They are fulfilled with what they do. They can create freedom for themselves and, be able to spend that time with their kids and their family and for their own self-care. And I'm a huge advocate of living holistically, and that's one of the things that is a bit of a thread through everything that I do. So if you are joining me live, then say hi in the comments. I know this is going out on LinkedIn, on Facebook, and also on YouTube as well. So if you are here, then do say hi in the comments and let me know that you're here, and do feel free to ask questions as well when you jump on. And if you're watching this on the replay, then do drop a little hashtag replay and, ask us any questions as well throughout the discussion. So talking of freedom and flexibility, I wanted to let you know about a really exciting event that I'm involved in. We are going to be running a dermatology clinic setup training event, which is happening on the 26th of September. And if you're wondering what on earth that is, it is a full day training event to help you, if you are an independent prescribing pharmacist, to develop your own private dermatology clinics in the community. It's something that myself and Sunil, who is a dear colleague of mine, the two of us have been doing for the last 6 months. We've been supporting pharmacists to develop their own clinics. And honestly, what these guys have been able to achieve is phenomenal. They have done so incredibly well. And we want to be able to share that with more pharmacists. So we are running our very first in-person training event, which I am so excited about. We have got an amazing clinical trainer, Dr. George Moncrief, who is a specialist dermatology GP who's going to be doing all the clinical training on the day. And if you're interested in joining us, then we are actually going to be running a preview webinar for it tomorrow evening. You can message me directly and I will send you the details. I'll also drop them in the comments here as well, somewhere along the line when we finish today's live. But do get in touch with me if you are interested, and if you are an IP pharmacist in the community and you are really passionate about dermatology, then come and join us and learn how to set up your own clinic. Now, talking of creating your own clinic, creating your own freedom, our guest for today's show is a pharmacist who has done just that. She is a pharmacist, a community pharmacist who has been a pharmacist for a number of years and took her hand to developing a pharmacogenomic service for GP practices in the US. And I cannot wait to get her on this show. So without further ado, I'm going to bring Jamie on screen and let her introduce herself. So hi, Jamie.
Hello, Komal. I'm so excited to be talking to you today.
Oh my God, me too. And Sunil's joined us as well. So hi, Sunil. We are really excited to have you. I'm so excited to have this discussion with you and learn more about you. So tell us, who are you, Jamie? What do you do? And in a really quick nutshell, tell me your story.
Yes, so I'm Dr. Jamie Wilkie. I have been a pharmacist for almost 12 years now, and I spent 10 of those at a traditional retail setting, working at Walgreens, and felt kind of stuck in my career. I enjoyed being a pharmacist, and I know I picked the right profession when I graduated pharmacy school, but just felt stuck after the years wore on and my job wasn't changing. And 10 years later, it felt like I was doing the exact same job as I was when I first graduated, with more responsibilities, or at least more pressure in that regard. And so I knew I wanted more and didn't want to spend the next 20 to 30 years of my career doing the same thing. And so I know the power of pharmacogenomics because of personal experiences in my family and friends, and also because I went through the certification program. So I have my pharmacogenomics certificate. And so it just was really bugging me that we have all this knowledge and power and can really help people, but in traditional settings, we're so limited. And so I said, I'm just going to create my own consulting practice out here in the United States based on pharmacogenomics, because I don't see any other pharmacists doing this in my area. There's nothing but opportunity out here. No competition for sure. And so I just kind of jumped off the deep end into entrepreneurship because I saw a need for change in pharmacy, but didn't see anyone else doing it. And so I kind of had to blaze my own trail.
I mean, that takes a lot of courage, Jamie. I mean,
No, it takes more courage to stay doing something you hate for 30 years than to pursue something you love.
Look, I'm with you on that. I'm totally with you on that. But I know that there's going to be lots of pharmacists who are watching this and they're going to be saying to themselves, whoa, I can't do that. I can't just leave my job and do something else. But, we will come on to that. I want to learn more about, what is pharmacogenomics? What is it?
Yeah. So pharmacogenomics is understanding how your DNA influences your body's reaction to medication. So just like we learned in pharmacy school with pharmacokinetics and pharmacodynamics and just those drug metabolism pathways in the body, this takes that information and helps us understand for our patients how their DNA is significantly different, and to make sure we're giving them the right medication. Because if you're giving someone a medication that doesn't work, that their DNA is processing it incorrectly to reach therapeutic levels, then that's not okay. It's not okay to living in 2021 to not take this into account, especially where the technology's been around for 20 plus years. And all it takes is a simple cheek swab. You don't even have to draw their blood. It's so simple. It's kind of crazy to me that everyone hasn't had this test, because people vary significantly, especially when you take different ethnicities into account. And when we're treating everyone as the same, that's crazy. And no wonder medications are out of control and are the 4th or 5th leading cause of death in the United States. Something has to be done. And as a pharmacist, it felt like it's our duty for our profession to really champion pharmacogenomics and make them standard of care.
I absolutely 100%. We know of pharmacogenomics. We learnt it. I mean, I would consider myself, a slightly older pharmacist, I would say. But, we learnt it at pharmacy school. We learnt about pharmacogenomics and the importance of it and how it can really transform the delivery of drugs, right? And yet, as you mentioned, we're not utilizing it nearly enough in our clinical practice. What do you think are the barriers? What do you think are the reasons as to why that's happening?
There's several. I think the first is that doctors are not taking it up, the medical doctors, because all this time labs have been targeting doctors to get their patients on board. But doctors, at least out here in the United States, are stretched pretty thin, and they just don't have the bandwidth to take this 100+ page report, digest it, internalize it, and appropriately use the results to change their patient's therapy. It's just overwhelming. And indeed it should be, because pharmacists have a doctorate degree for a reason, and it's so that we can understand this and do it, because this is already what we do. So I think one of the biggest barriers is that pharmacists have kind of been left out of the picture, that it's been labs trying to get doctors to get their patients on, and doctors are saying, I like it, I agree, I just can't deal with this right now. It's so complex. And really, it's more than just that PGx report and looking at that drug-gene interaction, what you really need to do for appropriate patient care is to zoom out and to do a comprehensive medication review and just bring every medication-related question under the sun to the picture and look at not only drug-gene interactions, but drug-drug interactions and duplicate therapy and what are they taking over the counter, and like bring that all in one place. And that's just a daunting task for anyone who's not a pharmacist. So I think that's the biggest barrier. The second barrier traditionally has been cost. The tests were expensive. And insurance wasn't paying for that. But every day, it just gets better and better. Costs are just now, for a cash price, a couple $100s. And now out here in the US, insurance is even covering it more and more. So it just gets better and better and better.
It's so true. I mean, the technology itself has moved on significantly, right? And you describing the fact that as pharmacists, we're actually in the key position to do this analysis work that, doctors just don't have the time and the bandwidth to do. And also it's a win-win for everyone, right? If you are doing a pharmacogenetic review of a patient, and as a result of that, you are making adjustments to their medication that is ultimately going to impact their health and make them feel better, it's a no-brainer. Right? It's a total no-brainer.
Yes, it's absolutely a no-brainer. And it really helps patients for the rest of their life because your genetics don't change. So once you do this report and help empower patients to understand it for the rest of their life, every interaction they have with their doctor and hopefully with their pharmacist is going to be different. They're going to say, look at me as a person. Look at me as an individual. Don't treat me with the same medicine and the same dose as that other person who's completely different, because when you're guessing and prescribing, that's going to give you problems, because that's what we're doing right now is just educated guessing. And so I like it that not only it helps patient care, but it helps empower patients to really feel more in control of their health and to understand it rather than just being a guinea pig and doing what the prescriber says.
Yeah, absolutely. And Sunil's just said personalized patient care, right? Which is, as a patient, if we put ourselves in with the hat of a patient, that's what you want, right? You want every single interaction with every single clinician, whether that be a pharmacist, whether that be a doctor, whether that be, a specialist, and then look at you and say, is this right for you? Right? And taking that holistic approach to you as a patient and saying, is this the right therapy for you? And not just applying, protocols and principles and, guidelines, and fitting you into those. It's the other way around ultimately, right? It's making sure that all the guidelines that are there, you've picked out the right things for the patient within those.
Yes, exactly. And the pharmacist role is exciting in that it can bring it all to the table, because especially polypharmacy patients, those who are on 5 or more medicines, are typically seeing multiple practitioners and multiple people are prescribing for them, and they're not necessarily talking to each other. And so the patient has to sort through and manage that medication themselves, and it's overwhelming and it's confusing. And so to have a pharmacist on your side to help you understand what's going on, to be your ally, is really awesome. And I think the power of the pharmacist of the future. We're getting away from adjudicating and a physical product of dispensing, and where our knowledge is going to be valuable in the future are those amazing patient interactions where we're providing so much education under the sun that's not just limited to a genetics consult. That's the start of a conversation, but you'll always need your pharmacist. And so as you're checking in over the months and years, you have a really high quality interaction with your patients that's truly helping them instead of just medicating them.
Totally. It's not just game changing for the patient, it's game changing for us as a profession. Like, it's so empowering, right? To be in a position where you can actually truly make a difference in a patient's life, right?
Yes, absolutely. That was what was frustrating to me so much in my previous career, is that I was just it was just all about adjudicating the product and like getting the patient the product, but there was no education. So these patients would come to me and they'd have questions, but I couldn't answer their questions. The phone was ringing, the drive-through was beeping. They had like 30 seconds with me, and it felt like this is where I can make the most impact, but my hands felt tied because of the structure I was in. And that's what patients are craving. They're craving that interaction.
There really are. It's one of the things actually that came out of the coaching that we've been doing for pharmacists. And the thing that I've said to the guys on the mastermind was, the thing that we value most as humans is time. Like, that's what we value the most. What's the biggest complaint that we hear from patients coming into the pharmacy? The doctor wasn't listening to what I was saying. I didn't get enough time with the doctor, right? And that is our most valuable commodity, our time. Time is precious to everyone. And to be able to spend that time with a single person and make a difference to their life is precious. That is the single most difference that you can make to a person, right? Is giving them your time and them giving you theirs, right?
Yeah, absolutely.
So Yusuf, hello, Yusuf. I love that you're on here and that you're listening to our conversation. So polypharmacy equates to poly practitioners. That's where we are going wrong. Key role for pharmacy professionals here. Absolutely. You know, what you've just hit the nail on, Jamie, is about the fact that, you know, we are sitting in that space where we can bring all of the information that's coming in about a patient from all these different practitioners and sift through it, right? Through the lens of the patient's, you know, PGx report.
Yes, and to their questions, and to just say, what do you want out of this encounter? How can I help you? And making it about them, to make sure their questions are answered and that it's actually helping them rather than just your agenda. So it's an exciting place to be, because most people haven't worked with a pharmacist like this before, and it's still a non-traditional role, but something that's gaining momentum, gaining traction, and is really good news for our profession that has been historically in very traditional roles without a lot of innovation over the years.
Totally. So I want to talk about how you started this then, because, you know, you really have been a trailblazer in this space. So talk me through what happened. You left, you know, you did your training in pharmacogenomics. And then how did you actually start your own practice?
Well, I did it while I was juggling working at Walgreens too, so that it wasn't like I just up and quit completely, because, you know, you have to build something first to feel comfortable before you leave. And so in my days off and in my precious time, I was just reaching out to everyone in my community. And I didn't necessarily have a full-blown business plan. I just knew what I knew, and I knew how I wanted to help. And so I started just reaching out to all the doctors in my community, those I knew, those I didn't know, through LinkedIn, and just started a conversation. And everyone who wanted to talk to me, I would happily get on the phone with them or go to the office and just explain who I was and that I was a pharmacist, and really spent the time asking questions of them, like, what's going on with your practice? What are the problems you're facing? Is there a way I can help? And people are really willing to talk and to tell you what's going well, what's going wrong. And once you understand their pain points and where they're struggling, then it's easier to show how you can help, rather than going in with your resume and saying, you should hire me, to just have and help. And so there was one doctor in the area who heard about this, and she was like, oh my gosh, I love this. Yes, I want you to come start seeing my patients. So I just have joined her practice as a 1099 contractor. So I'm not an employee. I'm still my own business, and I go see her patients and all of the clinic's polypharmacy patients. And that's been really rewarding to see that it's really not as hard as we think. And we get so stuck in our head of like all the reasons something won't work. If you just open your mouth and tell everyone what you're doing, either they or someone they know is looking for someone like you. You just have to open your mouth.
I love that. You just have to open your mouth.
Yes.
It's so true though, and how how you framed it in terms of, we are all collectively trying to help our patients ultimately, right?
Mm-hmm.
And we all are faced with difficulties and challenges in how we deliver that patient care. And what you did by going into those doctors' practices, speaking to those doctors and asking them questions, was identify where the gaps were, where the problems were, and then offering your solution. And I love that way of thinking. And that's what I've adopted in everything that I do, because that's the way that we have to approach all challenges. What is the problem here? How can I fill the gap? Do I actually have a solution that's right for that?
Mm-hmm.
Can I fill that gap? And if not, who else could?
Yeah.
Who else could fill that gap? So you started doing this and you got your very first contract that way. And so what's happened since then?
Oh man, that was just the spark that erupted into a roaring fire, because now more contracts have come, and so now I'm working with bigger clients that are like on the corporate level or on the lab level, because they've seen what I've been doing, and so they reached out and said, hey, we need some help building a PGx program or getting advice how to get into this space. So my clientele has grown. And also the thing that I'm so excited about is now I'm teaching pharmacists how to create their own practice too. Because for me, getting into the entrepreneur space was scary, because as a pharmacist, I don't know about you guys in the UK, but in pharmacy school, we learned nothing about business. Nothing at all. And so I didn't have any sort of background about how to run a business, how to get profitable, how to do proposals and invoicing and contracts and negotiating. That was all foreign to me. And so since I had to figure it out myself, it felt crazy that there wasn't some sort of program that can walk pharmacists through this. And so once I had my practice up and running, other pharmacists reached out to me and they said, hey, will you coach me? And I was like, oh my gosh, I would love to, but man, my time is so limited, because I'm also a mom with 4 little kids. And so I don't have all the hours of the day to spend one-on-one with people. And really, 90% of it is all the same. We don't need to reinvent the wheel here. We can all follow the same process. And so I created the PGx Consulting Confidence Academy, where you get walked through what PGx is, how to get certified, how to work with labs, how to talk to doctors, how to market your services, all the business models you can choose, all the other pharmacist-led services you can complement with PGx, and how to be an entrepreneur, just how to think like an entrepreneur. Because if you've been an employee your whole career, there's a lot of mind games that your brain can play. And so just to teach you what it's like to be an entrepreneur and kind of the ups and downs to expect. And it has been so fun, Komal. We're creating an army of pharmacists who are saying, I'm tired of being stuck in my profession. I know I'm more than this. I can create something new in my community. And we're just building a community of knowledge together. And it is so delightful and really, really a fun place to be.
That is so exciting. And I'm so, so happy to hear that there's someone like you who is doing that, because, I couldn't agree with you more in terms of the entrepreneurial mindset and the fact that, we as pharmacists, we really need to take on board some of that entrepreneurial mindset, whether you are working for a company or an organization, or, you're working for, over here, the National Health Service, it doesn't matter, right? Applying those entrepreneurial mindsets to, and the way of thinking to the work that you are doing is game changing. I can't, for me, that was the biggest shift that I had to make as well in my career. And, to go from being a paid employee to, to setting up my own business, was a hugely steep learning curve. But, it is a learning curve that I absolutely love. And I think it's one that is really empowering, and it's one that, we need to employ. So, we need to employ more of within our profession and think much more laterally and wider in terms of what we can do and achieve. So I've got so many comments coming in here that I really want to get some of these on board. So Hibby's saying, this way we make guidelines more personalized for patients. Exactly, right? We need to, it needs to be the other way round. I'm a great believer in that. Yes, we need evidence-based therapies, absolutely, 100%. But ultimately, the patient has to be at the center. And I don't personally believe we've got that right just yet. We're on that journey and we're still moving towards it. But yeah, 100% personalized for patients and that way round. And then she's also said, thank you so much, Hibby, for your comments as well. Problem solving and improving service, which is a great role for pharmacists, isn't it? We love problem solving. And I've always said this, we might not know the answer off the top of our heads, but we certainly know where to look.
Exactly.
And, and that puts us in such a great position. And Yusuf said, really inspirational hearing your story, Jamie. Thank you for sharing it so openly. Pharmacy is the passport to anywhere. Now, I know Yusuf and I are on the same page when it comes to this, in terms of the career opportunities that we can create for ourselves. You've created a completely new career opportunity for yourself.
And it's so available, and pharmacists just don't know, because that was me for so long. I was just spending my free time looking on job boards, and I was wasting hours a week just scrolling through job boards, feeling unqualified for everything, when it didn't even occur to me that I could just create my own job and help my patients in my community in a meaningful way. I was just so stuck in that traditional box of if I want a new career, it has to be a job I apply for and someone else is in charge of my future. No, that's crazy.
There's it's like a Pandora's box. Once you've opened it, there's just no way you're going to be able to put it back in, right? Sunil's asking, what was the key moment that changed how other healthcare professionals took this space seriously? And if you could go back, what changes would you make to get to this stage more effectively and efficiently?
Oh, that's a good question. I feel like I would have done it a lot sooner. I would have had the courage to just say, I can't wait forever. My dreams are urgent. I'm making this happen now. And I would have just started sooner. And I would have been invested in networking earlier, because all of my career I had no network. I just knew the people I worked with in person. And other than that, I had no connections. I wasn't even in pharmacy organizations in my state or in the country. I was just kind of in my own little box, living my own world. And so within the profession and without the profession, just knowing more healthcare providers and explaining and showing how, as a pharmacist and collaborator, that's when the magic happens, because a lot of doctors have never talked with a pharmacist before. They just have a lot of, at least here in the US, a lot of sales reps coming in. Someone's always trying to sell them something, but they've never had an independent pharmacist come in and say, tell me what your struggle is. Tell me what you need help with. They're blown away because they all have great experiences with pharmacists. I think 100% of them have said, I love the pharmacist. I'm always calling the pharmacy because I have a question about medicine. They can always help me. So they think of us really well. We're just so intimidated as a profession to show what we can offer. And so having those conversations with other healthcare providers and not being intimidated.
Yeah, I mean, I think you've hit on it in terms of networking, right? We just don't network enough. And, starting sooner, that is always, I think I can say that about almost everything that I've tried to do in my career,
Yes.
or that I have taken the steps to do. If I could go back, I would definitely do them sooner, and it's, I think, also surrounding yourself with like-minded people who are going to say, you know what you're trying to do is not crazy. I think that makes a big difference.
Oh, it's so true. It's so true. It was so frustrating to me for years working in traditional settings because there was a lot of technicians that would come through that I worked with, and they'd apply to pharmacy school and get in pharmacy school, and I was so excited for them. And so many of my colleagues would say, "Oh, watch out. Like, I don't think you should go to pharmacy school. If you knew what it was like to be a pharmacist, you probably wouldn't do it." And I was like, "Oh my gosh, you're so negative about our profession and so openly negative." And that it's just contagious. So if you surround yourself with negativity, even if you have great ideas, it's easy to be pulled down. So I completely agree, Komal. You have to surround yourself with like-minded people who are not only positive, but keep you stretching and keep you moving forward.
Yeah, definitely. Where do you see the future of what you're doing going? Like, what's your big plan? What do you want to achieve? With your Arches Academy and everything, what do you want to achieve with that?
Oh, to have a huge number of pharmacists who are integrating into the community, creating side incomes, changing their career completely and being supported to do so, and having the bargaining power of a huge group of entrepreneurial pharmacists to start making really big changes on bigger levels, to have the bargaining power to say, this is the future of pharmacy. This is a united group together. We're going to get from little things like the best prices for a lab to like true power negotiating with insurance to get the reimbursements a lot better. Things like that, to use this collective group as a voice together, because individually you can do a lot, but as a group and coming together, that's what's making me so excited. So I have a huge vision for this, for pharmacy, not only in the United States, but to take it around the world too, to empower other pharmacists in other countries to push the boundaries, to integrate PGx and to use that as a touch point for like true career expansion. No big deal. Reshaping the future of pharmacy.
What I absolutely love when I speak to entrepreneurial pharmacists like you is that not only is your vision big, but you also are so clear on changing the narrative around pharmacy. And that's what I really admire, and I get really inspired by that, because I am a firm believer that if we don't change our own narrative, no one else is going to change it for us, right? And us getting involved in pharmacogenomics, in what we're doing, the dermatology clinics, right? Getting involved in functional medicine, really applying our skills in new and innovative ways. We've got Mahira on this call, and she's a digital pharmacist. She is one of the leaders in digital pharmacy here. If we are not putting ourselves forward and changing our own narrative about ourselves, then we're not doing our profession any service. Right?
Yeah, exactly. Because the future is coming, whether we like it or not. So I use the analogy, you can just like put your head in the sand and ignore it and hope that nothing bad happens to your job. Or you can say, I see changes coming. I'm going to start making changes in my career, in my own time, in my own space, and have control over my career and my future, rather than waiting for a catastrophe and then trying to figure out how to come back from that, and doing it from a place of scarcity. I get to build it from a place of abundance, and it's fun, and it's a challenge, and it's awesome. And it changes everything when you're doing something because you love it and you're interested in it, rather than, I lost my job, now I need to replace that income quickly. Then it's just a totally different experience. So when it's in your court and you get to decide how you build your career, it's so fun.
Yeah. I so believe that myself, to build it. I love that. Build it from a place of abundance, which is where we're at right now. It's how you view things, So if I'm a pharmacist, I'm really interested in pharmacogenomics, where do I start? where should I start in terms of, educating myself?
Oh yeah. So come to my consulting academy. We obviously will teach you everything start to finish on what to know. And there's quite a few little CEs where you can get an hour or two of CEs to understand pharmacogenomics that are out there. There's full certificate programs if you want to get, the A to Z clinical knowledge you need to help your patients out. There's so much knowledge, and so much of it is free too, available resources. So if you send me a message, I will put you in touch with all my favorite resources. I have a PDF handout that is 3 pages of my favorite resources. Nearly all of them are free to just learn more and get excited about pharmacogenomics, from podcasts to guidelines to not-for-profits who are doing great things. There's so much out there. You just don't have the time to consume it all because there's just so much.
I mean, we've got some amazing, we've got some national funding that goes towards pharmacogenomics here, and that's getting fed down to, most certainly secondary level, secondary care settings. We've got lots of teams that are getting formed right now around pharmacogenomics, and the amazing thing is pharmacists are getting involved in that space here, which is amazing, and I'm just really excited to see that happening. But as community pharmacists, specifically as a community pharmacist in that space, it may be some time, right, before that knowledge gets disseminated almost down to you. And so, for anyone that's listening to this that wants to really learn more, then, contact Jamie and get in touch with her, and she will share that amazing PDF, which you're going to have to send to me because I'm really interested now. So we can learn more about pharmacogenomics and start thinking really innovatively around how we can apply it into our everyday practice, and start using it and utilizing it and sharing it with patients, and really seeing the benefit of that back to doctors and, the wider healthcare community, right?
Yeah, exactly. Because that's where I am, because there's a lot of programs in the works from hospital systems to academic centers, and it's slowly trickling down. And I see PGx coming slowly. But until then, there's no one helping my patients in my community today. And so we're coming at it from the grassroots angle and saying, let's start today. Someday they will meet together. But until then, you don't have to wait until there's an official program in place through the whole system you're at, that you can do work right now to help. So I'm glad you brought that up.
Yay. And Sunil's just said, until pharmacists see the potential worth, they won't take the brave step to enhance their practice and career. Talks like these really help the profession push the boundaries. And that I'm not afraid of that, Sunil, on this show. I love sharing these stories, and I can't thank you enough, Jamie, for spending your time with me this evening and sharing your story, talking about how you have integrated pharmacogenomics as from being a community pharmacist into developing your own consulting practice. And it's so inspirational. I can't thank you enough.
Yes, thank you, Komal. I wish I could join you and Sunil in London next week for your conference. I'm intrigued by that and all that pharmacists can do in the UK as with your unique prescribing status. So one of these times I'm going to come to your live events out in the UK and eat all the Bakewell tarts and go see all my favorite sites, because I love it out there.
We did connect on Bakewell tarts, didn't we? And yes, you will get plenty of Bakewell tarts for sure. I will make sure of it. I will absolutely make sure of it. And I would love to see you on this side of the pond, coming over here and sharing everything that you've learned through developing your practice, and inspiring as always. So thank you so much. And if people want to get in touch with you, then I've got you tagged onto this post, so you can contact Jamie through LinkedIn. And if you want to get that download that she talked about as well, then contact Jamie directly, and I'm sure she will send it out to you. And thank you so much. I will see you soon. I mean, thank you.
Yes, my pleasure.
Bye, Jamie. So that was the Happy Healthcare Professionals live show. I thank you guys, every single one of you who's watched this, and for all of your amazing comments. Really appreciate it. If you are watching this on the replay, then let me know what your biggest takeaway has been from the conversation that I've just had with Jamie. I would love to know what inspired you the most from the conversation that Jamie and I have just had. And once again, if you are an independent prescribing pharmacist and you are really interested in dermatology, then come and attend our dermatology clinic setup training event, which is happening on the 26th of September. I know it's around CPC, so I know there's going to be a lot of you guys who are going to be attending the clinical pharmacy conference. But if you are around, come and join us in London in person. We are going to show you exactly how you can set up your own private dermatology clinic in the community and make it a successful clinic for yourself, for your patients, and for your community. So if you're interested in that, then drop me a message. You can message Sunil as well, who has been on the chat as well, and we will be more than happy to support you. And we are actually going to be running a preview event tomorrow evening. So if you'd like an invite to that as well, then drop me a message and I will send you all of the details. But until next week, I hope you have a fantastic week and keep doing everything that you are doing. And I will see you next week when I will be talking to Sunil, because we're going to be talking about a dermatology training event. So if you want to hear more about it, then do come again next week and I will see you there. And I will see you on Wednesday. Bye.